Hello, everyone, and thank you so much, everyone, for joining this webinar today. I would like to welcome all the participants today on behalf of Healthcare Without Harm, Clean Air Fund, Global Climate and Health Alliance, Health and Climate Network, and International Federation of Medical Students Association. Thank you so much for joining today. We all know it's almost been a month since the UN climate conference COP26 concluded in Glasgow, and COP26 was a pivotal moment to implement the 2015 Paris Agreement. This COP, there were challenges. It was delayed by a year due to the COVID-19 pandemic, and it was also held during the pandemic where various countries, regions, communities, and economies are still reeling with the effect of the pandemic and the existing vaccine inequities. While the jury may be out on the success or the failure of the climate negotiations at Glasgow, this climate summit was historic in one aspect, and that was the focus on health. With the backdrop of pandemic itself and the accelerating impacts of the climate crisis on public health, the health narrative was present everywhere. There were discussions on health impacts of climate crisis. We saw a set of significant commitments for decarbonization and resilience from governments and non-state actors in the health sector. We saw public health professionals actively mobilized and present and engaged and marching in the streets of Glasgow to highlight the health impacts of climate change, health impacts of fossil fuel on health and people. So overall, COP26 witnessed a wide array of health-centered conversations and interventions. And in this webinar, we will attempt to unpack all the health discussions, or we'll try to cover all the health discussions that occurred at the COP. And we have a stellar panel who will help us understand this, and I would introduce them in a bit. The intention today is to discuss health ideas that emerged from COP26 and build on this historic beginning to ensure that policymakers include health in climate conversations in the future. Now, before we get into this conversation, I would like to have some housekeeping announcements. I would encourage all the participants to use the question answer icon on the navigation box for any questions that you may have. This webinar is bilingual. It is in English and Spanish. And we may have the translation slide. You will see in your navigation bar an icon, a globe kind of icon. And if you click on it, it gives you option for the language that you would prefer to hear this webinar in, that's English and Spanish. Please select your option and proceed with the webinar in your preferred language. The format of this webinar is going to be question answers, and given I'm the moderator, I'm going to be asking all the questions from our panelists. And we would cover all the panelists' intervention in the first round, and then we will open the webinar for questions from the participants so that we can maximize on their time, and we also hear from them, and then we hear their responses when it comes to question answers. Now, I would like to start today's discussion with inviting two of our youth health representatives on this panel. We have with us Mohamed Eissa, who is the Liaison Officer for Public Health Issues in International Federation of Medical Students Association. And we have with us Rhiannon Osborne, who is the Coordinator of People's Health Movement in UK. I would like to invite Mohamed first, and just to give you a little bit of background on Mohamed Eissa is a sixth-year medical student from Alexandria, Egypt. He's been volunteering in the public health field for the last 4 years and lately has been elected as the Liaison Officer for Public Health Issues at the International Federation of Medical Students Association. Mohamed is not just passionate about clinical medicine, but also for public health, and he believes in the importance of public health in ensuring healthier communities built upon health equity and not health disparities. Now, my question to you, Mohamed, which would be the same question to you, Rhiannon, because you were the two youth delegates and youth public health representative of COP26. What were your expectations at this COP? What were your interventions? And how do you see the climate and health connection shape up in this COP and in the future? The floor is all yours, Mohamed.
Yes, thank you so much for the introduction, and thank you so much for this question. I guess like while we were planning for like COP26, as the IFMSA delegation, we planned like some advocacy or some things that we wanted to achieve in terms of the climate action there. And one of the things that like we wanted to see is diverse and fair participation of all the communities and inclusion of the vulnerable community specifically, which unfortunately did not happen. So that was an expectation that, or maybe it wasn't an expectation, I couldn't expect actually that we would see this fair participation, but this is something that we wanted to see and something that we were very much looking forward to. We wanted this COP to be a place for generation of more evidence, generation of more data that could fill the gaps in terms of the climate change and health. But unfortunately, even like this is something I would explain later, one of the surveys that we have been working on, people were not very much interested in gathering data and gathering and like contributing to the evidence generation during COP. And one other thing that we were expecting that countries should listen more to the inclusion of health in the climate action. One of the reasons for this is that we can see that COP26 has been postponed for 1 year just because of a health issue, just because of a pandemic, which made us realize that, okay, countries need to understand that now is the time to focus on health, and now it's the time to put health in the center of the climate change negotiations. Some countries listened and some countries were interested, but many more were not interested, and many more had their own agendas that did not include health as one of them. And one other thing is that we also thought, okay, maybe the countries in general would not want to participate or would not want to engage, but maybe they would want to engage in the health sector. And this is something that we have seen. Through the COP26 health program, many countries have committed to the health program and committed to working on low emission health systems and working on carbon neutral health systems by different years, but still many of them committed to this program in an attempt to ensure that our health systems, which contribute much to the carbon emissions and the greenhouse gas emissions, can contribute to our mitigation plans. So this is something that like we wanted to look forward to. And something that is very important and actually did not happen in COP26 is that countries needed to listen to the science, but they did not listen to the science. And that's why like we have been there for 26 years asking for climate justice, asking for keeping the 1.5 degrees alive, but still countries are not doing enough and still are not listening to the science. Many reports have been launched before COP just to tell people, okay, the science is telling us we are in trouble, we are in a crisis, but still countries were not listening, and they did not listen till the very end. One of the things that also we wanted to look forward to is the fossil fuels, like stopping the fossil fuels, stopping everything related to fossil fuels. And although like we advocated so much for this, and many people, many sectors advocated so much for this, still the fossil fuel industry were part of the negotiations, which is like something that is very awkward when it comes to working on the negotiation that like actually are affecting our health and affecting our lives. And it reminds me, for example, of the Framework Convention on Tobacco Control, which happened years ago. At this point in this convention, tobacco industry were excluded from like working on the convention, because this is the realistic thing. This is the realistic approach. We can't ask the fossil fuel industries, okay, we are stopping your industry and we want you to be part of the negotiation that is stopping your industry. And what we have seen is that the fossil fuel industry had one of the largest delegations for COP26. And this is one even more awkward when we get to see like, what are we aiming to see at the results of the negotiations? And like one of the things, like the negotiations were going, okay, let's cut out fossil fuels, but at the end it was cut down fossil fuels. Let's just decrease the usage of the fossil fuels, which still make us in trouble, because the negotiations and the Glasgow Climate Pact shows that by 2100, we will still be at 2.4 degrees, way far from the 1.5 degrees that we're trying to keep alive. So what I have seen is that we were just putting text, we're just putting good words into the final text, keeping the 1.5 degrees alive, the right to health, things like that, but we're not doing enough, and countries were not doing enough. However, the only bright side, as I mentioned, was that countries started to listen for health. And as Shweta mentioned at the beginning, health was present there. Health was present through WHO Pavilion, was present to the Healthy Climate Prescription letter that was delivered and signed by more than 46 million doctors represented through their organizations and healthcare professionals, of course. And like health had their space, and still I could see that we can do much better by integrating health with all the other policies. We can't do this alone. And when we get to say, okay, we need health to be present in all policies, this is an approach that must be followed. And we must understand how health is interlinked with the other sectors, not just with climate change. Because like when we get to advocate, for example, for cutting out fossil fuels, or when we get to advocate for different issues that are relevant to other sectors, we would not be able to advocate well enough if we are not going through this together in like joint efforts and joint forces to stop these results, or stop like the climate crisis and try to deal with it in a more effective way. One of the things I also wanted to see, but unfortunately I did not see, that the focus mainly was the adaptation to the climate change impacts with no mitigation efforts. Okay, how are you going to reduce your emissions? Just promises as usual, but we could not see something that was being done or something tangible that can be done for this issue. What IFMSA has been doing, we have been going through conversations with country delegations together with the rest of the health community, trying to include health into the final text, trying to include health within the climate change negotiations in general. We prepared policy briefs on different issues that are linked to the climate change crisis, and of course the health emergency, sometimes related to the sustainable health systems, related to the food systems, related to the gender inclusivity, related to mental health, related to the climate change and health crisis in general. Policy briefs that would show where are we coming from, show us the evidence that we want to contribute to. We also contributed to several side events. So one of them about the sustainable health systems, one of them about food systems, one of them about how we see or how we envision the world in terms of the SDGs and in terms of the climate crisis, one of them on adolescent health in order to ensure that all target groups are being involved and being included. So we tried to share the voices of the youth, share the voices of the medical students. Because of the limited representation, we have seen how much this COP was an exclusive one, not at all an inclusive one. Financial barriers, COVID-19 barriers, vaccine inequity, so many issues that countries could have been prepared to, even in terms of pandemic preparedness. And this is another issue that even like countries are facing at the moment. We also contributed to different briefings with the health community in order to ensure that we're not just overlapping each other, but as I mentioned, we're joining forces together. We're doing things together in order to contribute to a decision-making process. And finally, IFMSA, together with another organization, worked on Diein. Rhiannon was also there, and she was like the amazing coordinator for this. We worked on a Diein regarding fossil fuels. We shouted, we made our points, we just like tried to advocate, but at the end, as I mentioned, like the results we had to have seen were very much like unpromising and like very upsetting outcomes, I would say. So this is in general what I would say, like in conclusion, in terms of what we want to see in COP27, better inclusion of health, better inclusion of all the communities, of all the vulnerable communities. When we say keeping the 1.5 degrees alive, we're saving lives in some areas. It's just like a matter of life or death for some areas. So we need to focus on this, and we need, again, to put health in the center of all policies and at the top, I would say even. So thank you.
Thanks, Mohamed. Thanks so much for your intervention. And before I ask Rhiannon to share more of her experience of the Diein that I've seen a lot of great pictures of and her own experience, I would like to introduce Rhiannon to our participants. Rhiannon Osborne is a health and climate justice activist based in the UK currently, and is in her 5th year of studying medicine at University of Cambridge. She's the co-coordinator of People's Health Movement UK and co-chair of Climate Change and Health at Students for Global Health. She sits on the executive committee of the UK Health Alliance on Climate Change and advises her local mayor for equitable climate policy in the region. Her other work includes access to medicines and refugee rights. In fact, I just saw a very a great video of Rhiannon today morning on the issues on equity and justice with and the policies that British government is bringing in on a lot of domestic policies that are discriminatory. But before going into that, Rhiannon, welcome to this panel, and please share with us your experience of this COP, your expectations, and what would you see as the way forward. And just as a general note to everybody, please be mindful, we have simultaneous translation. So I would request everybody to speak a bit slowly so that we can translate everything that you're saying in Spanish. Thank you very much. Rhiannon, the floor is yours.
Thank you so much for that really kind introduction, and thank you, Mohamed, for going before me and all of the amazing things you said. I think my expectations going into COP were very much that COP would not deliver climate justice, right? Because how can it, right? COP is run by big companies, it's run by rich countries, and they're the problem, right? And the idea that we can keep working within these systems and keep treating these people as if they're the solution when they're the ones who created the crisis is deluded. So I went into COP being like, I don't think that this is going to deliver climate justice, but I think there is still important things to do. And as Mohamed highlighted, the progress was really derailed by the fossil fuel industry being a bigger delegation than the small island nations. And we saw that play out in what came out of COP. They failed to get loss and damage for most impacted countries because it was blocked by the US, the UK, and the EU, mostly not wanting to talk about the debt that they owe to the global south. We saw huge amounts of racism when it came to the final text, blaming India and China for everything, rather than acknowledging the fact that the UK, the US, and the EU were the first ones to water down that statement and didn't want to have the burden of an equitable transition away from fossil fuels on their shoulders. Because if we look at who's most responsible for the climate crisis, we know it's overwhelmingly the global north, who are responsible for 92% of all excess emissions. So you really saw the inequity in the climate crisis play out during COP. And whilst I kind of expected it in my mind, I don't think I was ready for it emotionally. And I think it's like very, I will be like totally honest, as I would say, I was really, really low after COP, after seeing just how much apathy there is for the people who are going to be most impacted by this crisis. People talk, sorry, I'm speaking too fast. Just how much lack of care there is for the lives that are going to be lost because they're not people in power. And I think that we really need to reorientate our understanding of the climate crisis in the health community as a crisis of power and a crisis of inequality. And it's through that lens that we should be approaching it, because otherwise we're all going to have grand expectations of COP without thinking about the origins of COP and the origins of the power dynamics within that space. So yeah, I didn't expect there to be so much outright lying, so much outright greenwashing, and I did approach a few of my ministers and challenge them on this. They didn't like it very much, but it was fine. And I think in terms of my interventions, a lot of what I was focusing on with the People's Health Movement and others was redistributing wealth and power as a key thing as part of the climate crisis and as part of health equity. Because not only do we need to recognize that the status quo can't solve the climate crisis, but we also need to recognize that the systems that are causing the climate crisis have been damaging health for decades, and the people who have been telling us this have been ignored, right? We can't go carry on talking about the health impacts of the climate crisis as if everything else is fine, right? Everything else has nothing to do with this. It's only the emissions that are the problem, and that the health impacts of climate change that are the problem, right? Rather than acknowledging the fact that the climate crisis is deeply related to colonialism, to racism, to capitalism, to white supremacy, to patriarchy, and how all of these problems are part of the same picture. And we can't keep on saying, okay, the health impacts of the climate crisis are the problem, not the climate crisis as a symptom of a much bigger problem with the way that we run our societies and our economies. Because we can't keep our current levels of consumption and endless growth in the north and just switch the fuel, right? We can't just switch the fuel and say and keep taking and taking from the planet, sorry, I'm still going too fast, and say that that is the end of our climate action, right? So, and I think this is so important because in so many conversations, we talk about the climate crisis as if it's the future, rather than the fact that it's the present for people all over the world. It's the present for vast areas of the global south. It's the present for the indigenous people forced off their lands by agribusiness. It's the present for people living in fuel poverty in the UK. And it's been the present for the people of the Niger Delta who die before the age of 50 because of Shell's oil extraction in the area. And I think we talk too often about the climate crisis as this is just the problem that we need to solve, rather than thinking about the root causes of the climate crisis and who's going to be most impacted and who is least responsible for the climate crisis. And I think it's nice to think that if we have more evidence about the health impacts of the climate crisis, that people will act. And I'm not saying that evidence is not important, but sometimes we can be naive as the health community and think that because we're evidence-based, everyone else is, right? Rather than acknowledging the fact that the reason why action is not being taken on the climate crisis is not because there's not enough information, right? There's plenty of information. In fact, oil companies have hidden it aggressively for decades because there's so much information. What there is the fact that the people who are going to be most affected are those with the least power. And that's why there's not enough action at the moment. And until we have that analysis that takes into account inequality, that takes into account power, that takes into account systems of oppression, we're going to be hitting our heads against a brick wall, because we're going to be asking ourselves, why isn't action being taken? When action isn't being taken because people in power don't care about the people who are going to die, right? And I think that's like, we really need to like start absorbing that as the health community and thinking about how we mobilize to change that and to change systems of power, not just provide more evidence. And I think when it comes to the health community at COP itself, I think I won't talk too much about the blue zone because other people can speak potentially better on that than I can. I personally found the blue zone quite difficult because I just saw so much greenwashing, and I saw so many companies who are part of the problem have nice fancy pavilions, and I saw like, you know, my brothers and sisters from the indigenous delegation be locked out of the rooms while these fossil fuel companies were welcomed in. So, and I found that my favorite parts were leaving the blue zone. And I think we need to think about how health can act in a way that challenges systems of power and that acts in solidarity with communities, because not everything can happen inside the blue zone. And again, the blue zone is like the halls of power. So how do we act with movements on the ground who are protesting and demanding change? Yes, there were lots of people inside COP, but there were literally thousands of people on the streets outside it, you know, so many more. And there were health workers in that. And there are health workers who've been supporting community organizing, supporting community power across the world, across the UK. And we often give lip service to community organizing, but then ignore it in our strategies and ignore it in the way that we talk about health. Because the reality is that we need to work, yes, we need to do work on the inside and in COP, but the thing that's going to radically bring the level of radical change that we need to tackle the climate crisis is collective power outside the existing systems of power. And what I noticed from being both inside COP and outside it was that the wins we did have inside came from sustained organizing and public pressure. They didn't come from closed doors lobbying. They came from mass movements. They came from people walking out of COP because it was so unjust. And I think, what do we count as part of the health community is another really important question for us. In my mind, the Indigenous people protecting their way of life, leading the protests in Glasgow, defending their land and often being murdered for it, are as much a part of the health community as any of us are. And the solutions to the climate crisis are not going to come from billionaires or from governments like the UK. They are already in the minds and the communities and the hearts of those who are most affected by the climate crisis and who have and hold ways of knowing and knowledge that have lived in harmony with the planet for decades and millennia. And this is what we tried to do with the People's Health hearing, was to bring those frontline voices, both to talk about the intersecting injustices that they face of continued extraction and continued colonialism, but also their hopes for a better world, because we have to be bold in our vision of tackling the climate crisis, because we have to radically reimagine our entire way of living. And as well as talking about what we're fighting against, we need to talk about what we're fighting for and all our visions of collective hope and liberation. So I think to finish up, I would say that we can't talk about there being any success for health if climate justice isn't achieved. It's not a success for health if, you know, health is in the final text, but that text doesn't recognise the debt that the global north owes to the global south, or that text doesn't recognise Indigenous land rights, because the best health intervention that we could ever fight for is climate justice. So we need to talk about this as a justice and politics issue, recognise that inequality caused the climate crisis, and we can't tackle it without redistribution of wealth, without tackling colonialism, without tackling white supremacy, ableism, patriarchy, and classism. And we need to ask ourselves, are we challenging these systems, or are we co-opted and are we part of them? And if we don't do that, if we don't ask ourselves these difficult questions and think about a future which intertwines climate justice, racial justice, gender justice, and more, then we need to do better. And that's kind of what I felt coming out of COP. So yeah, I think that's it from me.
Thank you so much, Rhiannon, and really, really thought-provoking insights from both Mohamed and you. And I have a follow-up question, but I'm going to first have my other panelists sort of make their intervention, and then I will come back to both of you. So yeah, but thank you so much. That was sort of a very wonderful insight. Now I would like to invite Dr. Jeni Miller, who is the Executive Director of Global Climate and Health Alliance, for her intervention. And before we have Dr. Miller talk about, we've heard about the 46 million health professional voices at COP. What does this, like, how did this get mobilized? Help us understand why it is significant. What was the history behind it? Because this number we have never heard from before. And what are the other highlights that you can share? And just to introduce Dr. Jeni Miller to our audience, Dr. Jeni Miller is the Executive Director of Global Climate and Health Alliance. She leads the work of the Alliance, implementing its strategic direction and representing the Alliance publicly. In addition to her role at the Alliance, Dr. Miller currently serves as the chair of Environment Section of American Public Health Association, and she has over 15 years of experience working on place-based policy and systems change strategies to improve community environments for health, on leading initiatives addressing childhood asthma prevention, obesity prevention, climate change, health equity, and healthy community redevelopment. Jeni, the floor is yours.
Thank you so much, Shweta. And I need to update my bio because I'm now the past chair of the Environment Section of the American Public Health Association. Okay, I'm going to share a couple of slides because there are some images that will help me talk about the mobilization of the health community. Let's see. Can you all see my slides now?
We can see your home screen, but
okay, let me try again. Let me try again. How about now?
Perfect.
Okay, great. All right, so for those of you who may not know, the Global Climate and Health Alliance was founded about 10 years ago and is an alliance of health NGOs, health professional organizations, and health and environment alliances from around the world, kind of working together to elevate the influential voice of health professionals and health workers to protect and promote people's health by tackling the climate crisis. Both Healthcare Without Harm and IFMSA are founding board members of the Alliance. And since its very beginning 10 years ago, GCHA has been convening and coordinating active health engagement in COP and alongside COP. So the letter from 46 million health professionals. As Shweta noted, this was the first COP ever to bring the voice of the health community, at this magnitude to COP. And not only bring these demands to COP, but actually deliver them to the COP leadership. So the Healthy Climate Prescription Letter is a letter from organizations representing 46 million health workers and health professionals broadly across the health community. It was sent to heads of state and national lead negotiators at COP26, so the negotiating teams. And it was calling for equitable and ambitious action on climate change to protect people's health. The key demands in the letter, kind of echoing what Rhiannon was just saying, the key demands in the letter are demands for climate action, not just for kind of as valuable as it is to have health explicitly mentioned, some of the steps that we need to take really are about addressing climate change overall and addressing equity. So the key demands in the letter were to keep 1.5 alive, to limit warming to 1.5 degrees, a rapid and just phase out of fossil fuels and fossil fuel subsidies, increasing funding to low-income countries and meeting the promises that have made before, but also going beyond those promises for funding for mitigation, adaptation. And this year, we really saw the rise of the demand for compensation for loss and damages. The letter also called for pandemic recovery investments, the trillions of public dollars that are being invested to kind of restart economies around the world, that those be invested in green and healthy ways. And then we did also include a call for investment in low carbon, resilient health systems and health services, because we know that our health systems are also very much at risk from climate change and other things. The letter was delivered to COP. So the letter was developed in advance of COP, and the idea was that these demands should be circulating not just once we get to COP, because a lot of the conversations that determine the outcomes of COP happen kind of before COP itself. So we wanted these messages and these demands from the health community to be kind of in the mix and circulating, being heard, being in the media before COP. So the letter was opened for sign-on in September. It was publicly launched in October. And launched alongside with the WHO special report to the UNFCCC, the health argument for climate action, in a WHO press conference. It was then actually physically carried by bicycle, first from Geneva to London by Diarmaid Campbell-Landrum of the WHO, and then from London to Glasgow, where COP happened, by a group of pediatricians that organized the Ride for Their Lives, the cycling event to, in fact, ride from London to Glasgow, carrying the message that climate action, urgent climate action, is essential to protect the health of our children and people around the world. Once it arrived at COP, it was then actually delivered during a UK presidency event. So the UK government was the president of COP. There was a presidency health-focused event that elevated the health program that was a part of COP that you'll hear about in a bit from Healthcare Without Harm. And delivered to a representative of the COP26 presidency, which is the UK government, and to a representative of the COP27 presidency, which will be Egypt. Also, in its delivery, we developed a short video that carried the messages and the voices of the health community actually making these demands. And that video was shared during that event and then shared via social media. And it was viewed over 40,000 times in 5 days. It's a really fantastic video. If you haven't seen it, you should look for it and have a look. So the healthy climate prescription and that level of global mobilization by the health community didn't come out of nowhere. GCHA and many other health organizations have been organizing and mobilizing and working within the health community for years now. But some of the things that I want to draw attention to kind of in the nearer term that very concretely led up to this letter. Last year, in response to recognition that governments were investing these trillions in economic recovery for the pandemic, and that many of those funds were going to carbon-intensive industries, fossil fuel industries, and in fact, in some cases, taking us backwards in policies and regulations and in investments. The health community came together around another letter calling for a green and healthy recovery. And that letter was addressed to G20 leaders and G20 finance ministers to really speak to that issue of those recovery investments. And that got significant sign-on as well. We had sign-on from 4 organizations representing 40 million health professionals. That laid a groundwork of more and more health organizations and health professionals engaged on the issue than we had ever seen before. Throughout this year, GCHA, in collaboration with the World Health Organization and with the collaboration and support and involvement of many health organizations around the world, mounted a series of regional consultations in each of the WHO regions, convening health leaders region by region to talk about the health impacts that they're seeing from climate change, the solutions that that are happening locally that have potential, and also what they see as the needs and demands for decision makers to address these issues. Those regional consultations also created an opportunity for the health community around the world to provide input into the COP26 report that WHO developed. In September, another GCHA board member organization, the UK Health Alliance on Climate Change, which Rhiannon, I didn't realize that Rhiannon was on the board, so that's fantastic to hear. But the UK Health Alliance on Climate Change spearheaded the development of an editorial that was published in over 200 medical and health journals around the world concurrently. So this has never, ever, ever happened before, that this many medical and health journals would publish the same piece at the same time, first time ever. But they all recognized that the climate crisis is a health emergency and requires this level of coordination within the health community. There have been actions like the Doctors for Extinction Rebellion action in Geneva at the World Health Assembly that brought messages, the WHO's own messages about the urgency of climate change, brought that in a march to the WHO and actually met with Dr. Tedros, and a number of other kinds of actions like that around the world. And then finally, I've mentioned that we did release the letter alongside the WHO report at a WHO press conference, which really helped garner more visibility, more attention to actually, I think, to both of those things, both to the report, because the health community is backing the recommendations of the WHO report, and also brought more attention to the voice of the health community, giving it the kind of platform that WHO has. So this mobilization was, of course, not the only thing that was happening, from the health community and about health at COP. And as Shweta mentioned in the very opening, this COP had the biggest presence of health, the biggest visibility for health. Some of the other things that happened were a global climate and health conference. I've already mentioned the WHO report. Others have mentioned the WHO Pavilion, the first time WHO has had a physical pavilion at the COP for over the 2-week period. And Rhiannon was talking very eloquently about the importance of the activism. There was activism in the Blue Zone, activism from the Blue Zone walking out into the streets, and activism in the streets, as well as activism leading up to all of this. But the final thing that I want to talk about, just mention, is the health advocacy with COP negotiators. And again, I think Mohamed was talking about this, and we found, yes, I think Mohamed is quite right that some negotiators were not interested in hearing about health, but we found many that were ready to not only hear about health, recognized the importance of this issue, or were receptive to learning about it if they hadn't understood the connection beforehand. And beyond that, we're ready to be champions for talking about health, using the health argument to deliver stronger climate action and so forth. So I agree that this COP definitely did not deliver what we needed it to, but there's a lot to build on coming out of this, and a lot to build on by the health community. Many of the things that we've done this year mean that we can hit the ground running. And I would say we have to. There's no time to lose. There's a lot more that needs to get done, but we have a mobilized, activated health community and a lot to build upon in terms of how we engage.
Thank you so much, Jeni, for your intervention. And yes, I am, as I said to the earlier panelists also, I have a follow-up question, but I'm going to reserve that for the end. I would like to now invite Sonia Roschnik, who's the International Climate Policy Director for Healthcare Without Harm, to talk about Healthcare Without Harm's perspective on COP26 and the developments, particularly for the health sector at the COP and its significance. And just to introduce Sonia, she has worked in the health and social care internationally for 30 years as a clinician and in senior hospital management and in sustainability. As International Climate Policy Director, she oversees the work to support health systems around the world, including national and subnational governments, as they move to reduce their climate footprint towards net zero and become resilient leaders in addressing the climate crisis. Prior to joining Healthcare Without Harm, Sonia served as the Director of Sustainable Development Unit of England's National Health Service, and it was during her tenure leading the SDU that she launched the Greener NHS program, including a commitment to net zero climate emissions, positioning the NHS as the first national health system in the world to do so. Welcome, Sonia, and look forward to hear from you.
Thank you very much. And it's wonderful to be here. My first slide really says it all for me. It's that the climate crisis is a health crisis. And I think what COP said to me is that we're finally reaching the stage where people are beginning to recognize that. And I agree with Rhiannon and Mohamed that it's probably far from enough, but the fact that it's actually being recognized, and I think that's some of that's because of COVID pandemic, and where we've recognized the frailty of our human species really in the light of that we've been able to see an acceleration of the voice of the health sector and the health community. So for me, what this was really trying to do was build a moment for all of the actors that you've just seen and that Jeni has highlighted, working for the same thing really, that now it's time for action. We need to advocate for change, and we need to start showing that there are solutions, that actually the health community does know what it is that we need to do now to act and to accelerate our interventions. So some of these pictures will highlight some of the things that you've already heard, that actually the people on this planet really want a new future. And I think what I'd like to suggest is it's up to us to create that vision for what the future needs to be. We need to be very vocal about not just what we don't want, but actually what we think the future should look like. And you can see here one of the Diein protests on the right-hand side. The health pavilion was, others have mentioned, was also incredibly helpful because it was a gathering point for health professionals who probably often felt a little bit lost in this world of the blue zone. You would be able to gather together and actually reflect on what's going on. It was also an opportunity for, over 60 different presentations to highlight the work that is already going on and some of the solutions that are already available. And so as part of that, I just wanted to highlight the World Bank report, which is really trying to say, as we recover from the pandemic, there are ways of making our pandemic preparedness a low carbon response, a low carbon recovery, and making sure that it builds resilience as well. So for me, a lot of what we're trying to do now is to build this future with these strands of work that come together. And one such event that was particularly focused on that was this Future Labs event, trying to reimagine the future of healthcare. Now, this was special because the climate champions recognized health as a theme to be taken forward, that we really wanted to start looking at what pockets of the future might look like. And there was a diverse set of people speaking with a lot of solutions presented through these pocketbooks of the future. And part of the importance of that is, again, to reaffirm that there are ways forward, that the health sector can create a vision of what climate smart and resilient healthcare needs to look like, and by so doing, accelerate some of the social transformations that everybody has been talking about. And as a health professional and somebody who's been a health manager and now working with Healthcare Without Harm, I really believe that we've got a huge role to play exactly in that way. So the part of what happened in that session was that there was a graffiti artist trying to capture some of what was happening there. And Rhiannon, you might be happy to see that it recognized that capitalism drives the climate crisis, and that there are some systemic issues in our society that need to be addressed if we really want to look at what the future of healthcare needs to be. So it is about how we build a completely new model. And that needs to be particularly the case in low to middle income countries, where we still have to deliver access to healthcare universally everywhere, and do so in a decarbonized, resilient and equitable way. Of course, many countries have got to accelerate their transition, but we need to be thinking about how we reach the right kind of model for the future in countries that haven't got that yet at all. So the other piece that was super important, and I'm sorry that this slide looks so busy, but there was a coming together of organizations wanting countries to commit their healthcare systems to resilience and decarbonization. And when we started out on this, we weren't sure how much take up there might be. And we're pleasantly surprised that actually many, many countries see this as a very important step to be taking, not only to understand the vulnerability in your population, but also to start understanding how much your health system contributes to the climate crisis itself and what it can do to decarbonize and move further. So the extraordinary thing is that we had over 52 countries that signed up to these commitments. And many of these countries are in places where, climate change is a lived experience. But there were also many countries who are very high emitters. And overall, if you pick all these emissions from all these countries and added them up, the commitments, add up to more than 60% of the emissions worldwide. So we need to really support all these countries now to accelerate their progress to the change that is required, and to be able to do that in a way that is equitable and builds resilience in communities. So the way forward really is that we now need to, as I've mentioned, support these countries. We also need to race to a healthy recovery. There's something about how we make sure that as we're learning to live with the pandemic, we ensure that all of our health systems are low carbon and resilient. And the Race to Zero campaign brought together through the Healthcare Without Harm, which was the partner for Race to Zero in healthcare, over 14,000 different facilities through 52 members and more than 20 countries. And those are organizations that are not always sure about the pathway to get there, but who really see the sense in making sure that they're systematically measuring and reporting on their progress. So there is a real community of organizations that are already there and wanting to go further and faster. And I guess I feel as though it's part of our role to support them in that process. And of course, there's the health movement. We want to continue facilitating the growing health movement for climate action. And for me, it's not just highlighting that this is a health issue for most, and that what anybody does in agriculture or in all the other aspects of life and in society will impact on health, but also because these very same health people in the health community have got a role to play within their own health services to make sure that we manage the way we deliver healthcare in a sensible way. And that means that we might have to be looking at very different models of care in the future that are much more based around promoting prevention and promoting well-being so that we reduce sickness overall. And that's one of the areas that most interests me. And I was delighted that that came through in this COP as well. So I'm going to stop here because I think there's a lot of sense in having a discussion, and I look forward to all your questions. But I would like to say thank you to all the health workers around the world who are already not only supporting us all to be well, but supporting us through the pandemic, and also taking the time to highlight why this is such an important issue that we've all got to address now. So thank you very much. And over to you, Shweta. Thank you.
Lag and there might be some disruptions, but I'm internet completely goes away, which I think is a well. If I just turned off, I just the panel is Dr. Alison Doig from Health and Climate Network, and I would particularly like to invite her to talk about Health and Climate Network's 4 thematic non-health. You all, she's worked for more than 25 years in the international development and environment sectors with specialization in climate policy and clean energy. She's an experienced and effective policy expert and advocate, including prioritizing health in climate negotiations, climate action in the SDGs, and a shift towards investment in low carbon energy for all. She has worked through collaboration and network building and is particularly passionate about enhancing inclusion and diverse voices, particularly from the global South, in the international decision making. Dr. Alison, welcome, and the floor is yours.
Thank you very much. I'm really pleased to be here. So you'd asked me to talk about how do we engage non-health actors in the health and climate agenda, and that's where I'm going to focus. And as you've heard, I've worked on for my whole career on climate change, international development, and particularly sustainable energy. I've been part of climate networks for about 13 years, attended about 10 COPs. So I'm very much a non-health person. I don't come from that health background. But for the last year, I've been working with a number of people actually on this call today to help set up the Health and Climate Network, which aims to connect health sector with those other climate sectors, the food, energy, transport, the climate, people in the climate negotiation sector itself. So to look at joint sector action. And coming into this health space, I myself have been learning a lot about how intimately connected climate action and health outcomes are. I mean, I've learned so much this year. I've learned how cities can respond to air pollution and climate change at the same time. Same actions can have health and climate outcomes. I've learned about what links climate change, deforestation and obesity, a real revelation looking at health implications of the drivers, same drivers of deforestation and obesity. I've learned that sustainable transport's not just about high-end electric vehicles, but it's actually about healthy, safe, active transport for all people, getting people out walking and cycling and benefiting from the health of that. And really how the responses to climate and the responses for health can be greatly linked up. What I've learned really is an understanding that the health sector itself is a high emitting sector. Hadn't really crossed my mind before that, really to focus on health provision as one area that we could really target for this low carbon approach. But conversely, people most climate vulnerable, those most impacted by climate climate change are also often have the least access to resilient, accessible and dependable healthcare themselves. So there's a real contradiction there, as ever. But I would say, and I know that this year there has been a huge surge around COP of health actors, but I'd say that actually the climate world, those the negotiating spaces, all those other sectors are not really seeing health as, not yet, I think we're getting there, but not yet seeing health as a driving factor in pushing for higher ambition on climate change, not yet really focused on the win-wins that you can achieve between climate and health actions. And that's something that the Health and Climate Network is aiming to help change, working with many of the groups that are talking here and bringing in some new players. So what is the Health and Climate Network? We're a slowly growing group of organisations who want to take that cross-sector action. We started just last year, we focused on 4 areas: on energy sector, on transport and mobility, food and diet, and the health system itself. And so our partners are represented here. We worked also during the year with the WHO, the London School of Hygiene and Tropical Medicine and other health actors. But we've also worked, for example, with SLOCAT, which is a sustainable transport partnership, working across COP, but really now bringing in the health issues into their agenda much more confidently. Sustainable energy for all, looking at energy access in the global south, has been part of our engaged party. E3G, one of the top think tanks on climate change in the negotiations, another partner we're working with. And then the EAT Forum, which is a food systems organisation that has networks across the world in food systems. So we've been bringing these different sectors together to look at how health and climate change action can happen together. We started with our 4 briefing papers, and I'll put the link to the briefing papers if you've not seen them into the chat after I've spoken. But these 4 briefing papers and our 4 key themes were generated through joint workshops and collective policy making, across sector policy making, coming up with solutions that work for all parties. We did quite practical activities. We had cross-sector activities, such as we had medics speaking to transport ministerial meetings during the year and really bringing home that health implication of action on transport. We had a health focus at the World Food Summit, Systems Summit this year through some of our partners. And at the COI, the Conference of the Youth, we had youth activists talking about health and air pollution and climate change issues together. So really getting new voices into this space and linking and connecting these issues directly. And then at COP itself, we held the 4 events which are around our 4 themes. And I think part of our contribution, we weren't exclusive in this, but we were bringing non-health actors into that health space, getting that interaction happening. So, for example, we had Strathclyde Partnership for Transport telling us about the integrated and active transport, integration of public transport and active transport in the city of Glasgow and raising health and air, clean air in the city of Glasgow itself at our transport event. We had young people in video portrayed from the World Obesity Federation calling for joint action to deliver healthy diets and climate change together. And then at our energy event, we had an amazing social activist who works on gender and community rights in South Africa, talking at that energy event about a just transition out of the coal dominance in South Africa into sustainable energy for all. Really dynamic speaker. And the beauty of the WHO Pavilion this year at the COP, in the COP space, was that there are activists who is really quite a remote part of South Africa, was able to transmit directly in and present just the same as the ones who were presenting from Glasgow from that pavilion itself. It was great to have that interaction. And I think that emphasises one of my core learnings from the year. And what I've learned is that really to get the health and climate action happening, you have to get that diversity of voice into the decision making of coming up with health and climate solutions. You need the right people in the room to get those solutions for all people. You need youth voices, Indigenous voices, representation from across the globe in different social spheres. And you need, what I find in general, and I think Rhiannon and Mohamed really eloquently said that many of the climate solutions that are coming up are really about northern wealthy interests. They're not about climate and health solutions for all. And I think that's where that diversity is really, really important in this space. So just to pick up a few, I mean, I think there are a few of the themes that are coming out of the official negotiations at COP. Health was sparse, shall we say, in the official, represent all the official negotiations and outcome at COP. But I think there are issues that we need to pick up and jointly work on together. That keeping 1.5 alive, how do we keep the 1.5 degree temperature target alive? And I think the health imperative of staying below 1.5, the threat of going over 1.5 degrees of warming, I think we really can get the health argument strongly in there in the coming year. The coal phase down, the phase out of inefficient fossil fuel subsidies, pushing for more language, stronger language and phase out of fossil fuels, looking at the air pollution benefits of doing that, looking at how you can deliver sustainable energy for all. These are arguments that the health, non-health communities can come together and call for. On food systems, there was a new dialogue, the FACT dialogue came out, which is forest, agriculture and commodity trading. And I think increasingly in that space, the move to a largely plant-based diet, a healthier diet, can be part of that discussion. Also delivering local resilient food systems is another argument that can be brought in there. And then another outcome from the COP was looking to the call for a doubling of adaptation finance and the establishment of an adaptation goal. If we're going to spend more money on adaptation, it's urgently needed. We need it to be high quality adaptation that's in the right place at the right time. And I think looking at how you can integrate health resilience into that adaptation space and really make that stronger health arguments for delivering adaptation across the globe is another area that we can link up those two sectors. Just a couple of minutes left, really. There's a few opportunities throughout 2022, and I think we need to take some of this thought and this energy and this dynamism into 2022 and look. There's a couple of key things that are happening. I think the IPCC, the Intergovernmental Panel on Climate Change, the scientific authority really in this climate space is releasing a few reports. The adaptation report in February will talk health and needs health professionals to amplify that voice of health and adaptation. There's a mitigation report in March. It won't have a lot of health in it, but we know that by mitigating through energy systems, clean energy systems, through reducing deforestations and other measures, there are strong health implications and co-benefits from that. We need to amplify that voice. We've got the Convention on Biodiversity will have a big meeting also in April. There they'll be looking for 30 by 30 targets, saving 30% of the world's nature, both in land and sea, by 2030. There's a big health message, resilient, secure food systems, for example. Great to get some non-health people into the World Health Assembly talking climate, working alongside the health sector there, the World Health Assembly. And then, of course, at the end of the year, we will have COP27 in Egypt. And we're looking for that to be the Africa COP, to raise those southern global vulnerable voices from the global south in Egypt next year. So that's looking a year from now. So thank you for inviting me to speak here, and happy to take questions.
Thank you so much, Dr. Alison. This was great to hear from you. And I will have questions for you, but I would also like to have our last two panelists share their thoughts before we go into questions. Our next speaker today is Sean Maguire, who's the Director of Strategic Partnership and Communication at Clean Air Fund. And Sean, my question to you is, I would really like you to speak about the interventions around air pollution, fossil fuel and health, and what were your quick takeaways, especially given that there was so much chorus on the message of ending fossil fuels, subsidies, no new fossil fuels. I mean, there were parents who were rallying around, there were youth activists, health folks who were rallying around. And how do you see the impact of this on the discussions at COP, and how do we build and strengthen this global momentum from here on? This is what we particularly would like you to share your thoughts about. And for our participants, I would like to introduce Sean. He's responsible for resource mobilization, building alliances to achieve clean air, and effectively communicating the challenges and solutions around air pollution at Clean Air Fund. He's also worked widely across development and humanitarian communications, public affairs, sustainability advocacy, and global campaigns on gender equality. He has also worked for the International Committee of the Red Cross and the UK government. Sean, the floor is yours.
Thank you, Shweta. Shweta, how long have I got? I'm conscious that we want to leave time for questions.
I would still want you to have your 10 minutes, and
okay.
We will accommodate all the questions later.
Okay, all right, okay. I'll fire away then, and if I go over, please draw me to a halt. Thank you very much for having me on. Lots of great speakers have already talked about the kind of mobilization of health professionals and some of the things that we should be trying to do in the advocacy space going forward. I wanted to speak a little bit about the mobilization of patients and ordinary folks for health, and in particular the efforts of mums and parents under the banner of the Our Children's Air campaign. A global group of parents came together, 500 parents groups from 44 countries, led by some really powerful champions, people like Rosamund Advocacy Deborah from the UK, Warrior Mums from India, the Mums Clean Air Force from the USA, and Voices from Poland. Really strong advocates for clean air and for health. And what was it they were actually pushing for? Well, it was attention to the health harms from air pollution and climate change on children, and asking for urgent action at COP to reduce this. So that was what the ask was. And specifically, they wrote a joint letter to the heads of state calling for an end to all new fossil fuel exploration. And they delivered it to Alok Sharma at the COP president. And this generated quite considerable press coverage under the banner headline, "Fossil fuels are killing us." And they suggested that the first step forward should be an end to the financing and licensing for all new fossil fuel exploration today. So why am I going into the detail of this? Well, I think the notable components of this call to action were that it was quite specific, it was reasonably achievable, and it explicitly linked air pollution through to climate change, and it explicitly linked individual health through to planetary health. And I think that's an approach that we can build on. Now, what was the impact of this particular campaign? Now, obviously, this was not the first or the last call for the end to fossil fuel explorations. And as Jeni said, there was the very effective Healthy Prescriptions letter, which also had language in it around ending the use of fossil fuels as well. So I think, you know, this campaign added to a growing chorus. It added to the voice from the street. It added to the growing chorus from scientific experts, from the IEA, from the IPCC, from the UN Secretary General, and the other pure climate change campaigners who were not looking at this issue from a health angle. So, you know, and I think the other thing it did was it resonated with the negotiators and the countries that were willing to put forward previously unimaginable restraints on fossil fuel activity as language for the COP outcome document. So we did have friends in the negotiating room, as Jeni had mentioned before. So this was a campaign that was both moving with the tide and helping to build the energy and the momentum of the tide. So I think it's really important to recognize that you're going to need a lot of voices from a lot of different directions in order to achieve the change we need. And I think it was really important that we had the voices of patients with their own individual lived experience of the challenges of air pollution and climate change coming to Glasgow and being heard at COP. And of course, we know the outcomes of COP. We know there was progress in key directions, disappointment in other directions, that it didn't go further, especially with the last minute watering down of language. But in some ways, it was remarkable progress that we got any mention of fossil fuels and the need to phase out the inefficient fossil fuel subsidies. It was remarkable in some ways that we achieved that, and it was a real turning point. But of course, we know it's not enough to achieve a 1.5. And it's certainly not enough to reduce air pollution significantly, or really at all. So, just as an aside, speaking to the issue of the effectiveness of campaigning, one of the problems with air pollution as an issue is that there are huge numbers involved. And because the numbers are so huge, they're almost numbing. They don't carry much weight. People really struggle to get their heads around the fact that 7 million people a year die as a result of overexposure to air pollution, and that's a number from 2016. So it will be higher than that. And we know that in 2016 that 600,000 children under the age of 15 die each year from air pollution. And the most recent statistics suggest this was from the State of Global Air last year. The most recent statistics suggest that 500,000 newborns die each year from air pollution. So these are appalling and rather numbing sort of large numbers. But I think the most alarming thing that I tend to focus on is the trend rate. So the trend rate for global mortality due to air pollution, ambient air pollution, outdoor air pollution, is that it is expected to double by 2050. So this suggests that air pollution will be almost inconceivably deadly in the coming decades unless we accelerate action on fossil fuels further. So we need to really build on the toehold that was achieved at COP26. So I want to offer a couple of suggestions on what we can do next. The first thing I think is we absolutely need to keep campaigning. Other speakers have spoken about the breakthrough we've had in being able to link health to climate and having the visibility of health within the climate space. And I think we need to keep those two issues chained together. And we need to find ways to make the issue personal, human, immediate, and tangible. And air pollution is an issue that does that once you get away from the large statistics and you can start to tell the individual stories of those affected, which is why I think the voices of parents and mothers in particular are so powerful and need amplified and supported to be heard. So we need to campaign on this issue at really every level, the local level, the national level, and the global level. Within the negotiating rooms, we've got this toehold, so we need to press on. And both Jeni and Alison have spoken about doing this. And there are many forums and processes where we can intervene with strong insider advocacy. We need to be raising our voice in the G20 and G7 space, at the UNGA, in the kind of Davos type space, and in national and local elections. We need to make it an issue that is heard about everywhere. So we really need to press further in fossil fuel reduction and elimination, because this issue is only going in one direction. The question is the speed and the pace with which it goes. If we can hasten the speed, we've got a chance of preventing irreversible destruction of our environment and our collective health. We know there will be a COP again in Egypt, and we know also that countries have been asked to revisit and strengthen their plans, to revise ambition higher. So this is an opportunity to press states for better nationally determined contributions. So instead of every 5 years, we now have the opportunity every year to press for stronger 2030 emissions reductions targets. And also for the countries that haven't set ambitions yet for getting to net zero by 2050, there is a call for them to do so by the time of the next COP. So we really need to push at the country political level and at the regional level and at the global level as well. And I think the third and final thing to make the two other approaches efficient is that we need to bring climate change advocates with us, and we need to engage health philanthropy much more in the air pollution and climate change issue. We know there was resistance from negotiators to putting mention of health into the COP outcome documents. So there is more to do to convince delegates and negotiators that health must be highlighted as a major consequence of climate change, and therefore is another reason to act. So for that to happen, we need those advocating for climate change action to see health issues as central to their concerns too. So, and I'm not sure that the message has really completely gotten across yet to our friends in the climate change community, so we need to keep convincing them. And from the other side, we need to be encouraging more health philanthropy and funding to go into climate change and air pollution issues. From the Clean Air Fund's own research into funding flows, we know that the vast majority of philanthropic funding in air pollution comes from foundations that are working on climate, energy, and environment. And very little, a puny amount, a tiny amount, just $11 million in 2020 is coming from foundations that have health as a focus. So we really need to change that, because the health foundations are important and powerful, and they're not looking at this issue with the seriousness with which they should. So that's my three key recommendations then. Keep campaigning, step up the insider advocacy, get climate change advocates on our side, and get the health funders to come on board and fund what we need to fund. Thanks very much.
Thank you, Sean, and you've just been so perfect with time. Thank you so much. Our last speaker today, last but the least, is Dr. Erika Arteaga-Cruz, who is the coordinator for the People's Health Movement. And my request to Dr. Erika on the COP26, climate justice and health equity. Okay or not? All the participants mentioned that Dr. on translation should switch to Dr. Erika. Dr. Erika is Environment and Health Circle of the People's Health Movement and coordinator of the Environment Network of Latin American Social Medicine Association. Erika is a mother of two, a professor of San Francisco de Quito University, and a PhD candidate in collective health, environment, and society, Simon Bolivar Andean University, advisor for the traditional birth attendant school of Ancestral Knowledge Council, Kichwa Kota Chachi Peasants Organization. I'm sorry if I'm not pronouncing anything right, but Erika, welcome, and please share your experience.
Buenas, comienzo poniéndome el cronómetro. Quería comenzar con una anécdota. Me dicen que me presente de nuevo. Soy Erika Arteaga-Cruz y soy la co-coordinadora del Círculo de Ecosistemas y Salud del Movimiento para la Salud de los Pueblos. Mientras estoy hablando, quería que me ayuden compartiendo una foto resumen de lo que fue la Audiencia por la Salud de los Pueblos, que es un esfuerzo conjunto entre el Movimiento por la Salud de los Pueblos, Students for Global Health, MEDACT, Actions Speak Louder Than Words y Raise and Health, que es lo que tratamos de hacer también online en el marco de la COP26. Quería comenzar contándoles una anécdota personal, porque me dicen un poco que haga las reflexiones del Movimiento por la Salud de los Pueblos en este tema particular. Y es que hace una década, cuando yo tenía 30 años, fui como delegada del movimiento, por idea de David Legg y Hani Sarak, al consorcio, a una reunión del Consorcio de Universidades por Salud Global en Seattle, ¿no? Y comienzo una charla en Seattle con unos ídolos internacionales, digamos, de estos héroes. Entonces, el panorama es más o menos el siguiente. Sale una foto de Martin Luther King, todo el mundo aplaude. Sale una foto de Madiba, Nelson Mandela. Sale una foto de Gandhi, y entendía, y luego sale una foto de Bill Gates. Y yo no entendía, hace 10 años, qué tenía que ver Bill Gates con estos referentes mundiales. Una década después entiendo perfectamente, porque es el hombre que está diciendo qué es lo que se va a realizar en la agenda en salud a nivel internacional. Quería comenzar con esta imagen. Después de comenzar con esta imagen, retomar un poco, y me dicen que hable un poco más lento. Lo que ya nos estaba contando Jeni, ¿no? Que The Lancet y más de 230 revistas médicas llamaron a la acción en septiembre. Y es claro que nos enfrentamos a una catástrofe global. eso nos dio un montón de esperanza porque era ver un artículo en The Lancet que refleje las luchas que nosotros en el sur global hemos estado teniendo por décadas, con médicos y médicas en el territorio. Sin embargo, el resultado de la COP26 fue devastador. Para 1848, Virchow ya había dicho, la política no es otra cosa que la medicina a gran escala, para demostrar que el componente social, es decir, cómo la sociedad va modelando la salud de las personas. Esas personas y esos pueblos que nosotros servimos como médicos y médicas, con entidades de política pública o como funcionarios y funcionarias del órgano rector de la salud, que es la OMS. Han pasado casi 200 años y asistimos a esta misma dinámica. Hoy es necesaria entonces una reflexión histórica, más que soluciones tecnológicas simples. Vivimos en un mundo enfermo, el mundo está enfermo, y la enfermedad, como dijo Rhiannon, es el sistema opresivo basado en las tres opresiones, ¿no? La colonización, que en el norte le llaman más bien white supremacy o supremacía blanca, nosotros aquí seguimos diciéndole colonización, el patriarcado y la lucha de clases, ¿no? Entonces, estas soluciones simples como un no a todos los combustibles fósiles, por la que nosotros hemos estado peleando por años, en mi país de Ecuador desde 1970 por lo menos, no son suficientes. Y no son suficientes decirles no a los combustibles fósiles, porque sin los combustibles fósiles todavía hay una enorme carga de la crisis sobre los hombros del sur global. La extracción minera de litio, cobalto, tierras raras, la extracción maderera en la región amazónica, estos bosques que son necesarios para tener energía eólica limpia para el norte global, nos van a cobrar factura a nosotros en este lado del mundo. Entonces, es necesario, como decía Rhiannon y dijeron varios de los colegas, cuestionar radicalmente nuestros modos de vida. Tampoco es suficiente, vemos nosotros, y es la postura del movimiento, reducir las emisiones de carbono de los servicios de salud. Porque en países como el mío, en Ecuador, estos servicios de salud se construyen con fondos de la extracción petrolera hasta ahora y se construirán con fondos de la extracción minera que va a sostener esa gran transición climática que están proponiendo en el norte global, ¿no? Esta forma de green energy o los Green New Deals, estos pactos globales verdes, ¿no? Entonces, hablamos del compromiso de los países con el programa de salud de la COP26 y de la OMS. Nos preguntamos cómo podemos presionar más a cada país, pero no tenemos en cuenta que países como el mío están sometidos por el Fondo Monetario Internacional, están sometidos por el Banco Mundial o el propio organismo de resolución de conflictos de estas entidades, el CIADI. En inglés esto es el ICSID, que es la institución más grande del desarrollo, que está dedicada a solucionar las disputas en cuanto a financiamiento internacional. El CIADI ha legislado todas las veces a favor de las industrias extractivas cuando se trata de enfrentarse a países tan pequeños como el mío. Y para nosotros, la base de todo el cambio climático, como decían todos, y la salud, es esta forma de desarrollo en un mundo enfermo, en donde el extractivismo es uno de los ejes importantes de discusión. Les volví a decir que en mi país, la política económica que determina el Fondo Monetario Internacional, y que hemos peleado nosotros en las calles desde el 2019, como les consta, varios países de Latinoamérica desde el 2019 tuvieron estas peleas por tratar de recuperar soberanía. Pero estas fuerzas internacionales grandes son más potentes y entonces esta porción, la política económica del Fondo Monetario Internacional, dice que parte del préstamo que recibimos nosotros como del Fondo Monetario Internacional para la crisis económica y esto tendrá que ser pagado con fondos provenientes de la extracción minera. Y esta extracción minera está a cargo de empresas australianas, canadienses, chinas y en su mayoría empresas potentes del norte global. Es hora de reconocer además, nos parece, que los propios servicios de salud y la medicina es una forma de colonización. Esto también discutimos en la audiencia por la salud de los pueblos y pueden ver en una parte del gráfico. Es una forma de colonización sobre los saberes ancestrales y sobre los saberes indígenas que protegen territorios y que construyen salud. Tal como dice el gráfico, pueden ver ahí, dice la selva es viva, la selva es en sí salud. Y mientras no entendamos esta relación con el territorio, que es además sacralizada, y tratemos de seguir midiendo en indicadores de medicina basada en evidencia e indicadores de porcentaje, ¿no? No vamos a poder hacer este cambio que queremos. Quería contarles que la Audiencia por la Salud de los Pueblos trató de escuchar y dar cabida al testimonio de estos pueblos que resisten en sus territorios, los que están en primera línea, los que se enfrentan al sistema de los 3 niveles de opresión, que es la clase, la raza y el género, pero que no necesariamente aparecen en los titulares de las noticias. Los conocimientos y los modos de vida indígenas son muy importantes en este momento trascendental de la humanidad. Estas voces de la primera línea, las formas colectivas de conectarse con la tierra de manera sagrada, esas formas difieren mucho del modo de vida o de la visión del mundo de un solo multimillonario, como Bill Gates, que financia en solitario la mayor parte del presupuesto de la Organización Mundial de la Salud y que ha sido continuamente esto criticado por el Movimiento por la Salud de los Pueblos y cuya perspectiva ha dado esta forma al programa de vacunación, el COVAX, con terribles desigualdades, ¿no? Ahorita justo estamos leyendo los informes de Amnistía Internacional sobre esta inequidad brutal en países del sur global y también los reportes de la Alianza Africana a propósito de la variante Omicron. Entonces, para mí fue muy miedoso saber que Bill Gates además van a financiar con esa visión a los países en desarrollo, países como el mío, que se adaptarán a los sistemas de opresión con tecnología, mitigando así su pérdida de vidas. Hace casi 530 años en las Américas se soporta la colonización. Y cuando normalmente hablamos de esto, nos dicen es cuestión del pasado, hay que ver formas pragmáticas de tener soluciones ahora. Pero no es del pasado lejano. Y no es del pasado lejano porque los huesos de los niños y niñas enterrados bajo las iglesias canadienses nos recuerdan que la colonización es un dolor presente, que las víctimas del cambio climático, del desplazamiento de las industrias extractivas, principalmente en los territorios indígenas, nos recuerdan cómo la colonización sigue en curso y todo eso, el desplazamiento y la migración, gente muriéndose en las costas de Europa, ¿no? Con barcos hundidos, niños presos en el borde de Estados Unidos, niños migrantes, son problemas de salud pública. En la Audiencia de la Salud de los Pueblos tuvimos un espacio para el dolor. No podemos hablar de victorias. Yo creo que no se puede hablar de victoria del sector salud. No hay victorias en la COP26, porque hay millones de vidas en zonas de sacrificio, vidas desechables, que siguen, ¿no? Entonces no se trata de las bonitas intenciones que tengamos. La gente aquí se está muriendo y tenemos cientos y cientos de defensores de los territorios asesinados por enfrentarse a las industrias extractivas. Y todos estos componentes sociales son una parte importante de la salud. Pretendemos entonces, como después de la Audiencia por la Salud de los Pueblos, que tuvo esta colaboración de varias organizaciones, ¿no? Y la organización estuvo a cargo de esta solidaridad muy linda del norte con el sur. Pretendemos conectar las luchas contra el extractivismo y las luchas para detener el cambio climático y la lucha por el derecho a la salud. Cómo todo eso puede darnos forma para poder, como decía Rhiannon, tener este combustible que fue la lucha de afuera que mueve lo que pasa dentro del lobby, ¿no? En la COP26. Entonces no es antiguo hablar de la acumulación capitalista a través de la extracción de recursos que incorpora no solo el valor del trabajo de los trabajadores, el plusvalor, sino también los productos de los procesos biogeoquímicos que pueden ser milenarios, alterando y destruyendo los mecanismos que mantienen nuestro ecosistema en el cuidadoso equilibrio necesario para sostener la vida. Hay que cuestionar de dónde viene el dinero para construir estos servicios de salud que queremos que todo el mundo tenga acceso a servicios de salud. Sí, muchos de los servicios de salud se construyen con dinero de la industria extractiva. Pero nos dimos cuenta después con la Audiencia por la Salud de los Pueblos que esta oportunidad de conectar las voces del norte y del sur, de sentir y pensar colectivamente nuestras resistencias, nos dieron otras formas de soluciones. Y las soluciones, nos dimos cuenta, no van a venir de los grandes líderes mundiales, porque la COP26 fue una derrota. No van a venir de Bill Gates ni de Elon Musk. No va a venir del universo meta de Zuckerberg. Nos dimos cuenta que éramos nosotros mismos, nosotros y nosotras, a quienes hemos estado esperando. Es decir, la esperanza está en qué es lo que nosotros podemos hacer. Y terminamos después de una audiencia con dolor, que pudimos sostener el dolor y ver cómo lloraron nuestros compañeros en África o en Irak, Irán, los territorios invadidos también en Afganistán. Con esperanzas más altas por una acción colectiva en la que no solo la tecnología va a cambiar nuestra forma de vivir, ni tampoco soluciones simples como eliminar todos los combustibles fósiles porque vamos a hacer la transición a la minería, o soluciones simples como que los sistemas de salud reduzcan su emisión de CO2. Para concluir, y quería saber si todavía tengo tiempo, decirles que quería concluir esta imagen del Consorcio de Universidades por Salud Global con Bill Gates como un héroe, y yo me quedé como muy asustada. Tal vez yo tengo la perspectiva de que es un héroe porque vengo de una región donde tenemos médicos como el Che Guevara, médicos como Salvador Allende, que fue presidente de Chile, con una perspectiva de cambiar la sociedad para poder transformar la salud. Pero también que estoy aprendiendo en esta forma de descolonización, despatriarcalización y reducir la inequidad de clases sociales de las chicas jóvenes que están encendiendo este continente, ¿no? Entonces, contarles una anécdota chiquita. Fui a Chile en el 2019 y ahí había un mural enorme del Che Guevara, ¿no? Y para mí era muy importante. Y las chicas pequeñas dijeron, borren eso. ¿Por qué? Porque es de un solo hombre. Y nosotros nos quedamos como indignadas. Y borran el mural y dicen, bueno, ustedes mujeres jóvenes, ¿qué es lo que quieren que se ponga en el mural? Dijo, el rostro de alguna mujer. Y les dijeron, o sea, ok, ¿qué mujer quieren que reemplace esta figura icónica que es el Che Guevara? Y ellos respondieron, cualquiera, porque puede ser cualquiera de nosotros, no es una, es la acción colectiva. Y creo que esa es la fortaleza que aporta a estas nuevas generaciones y que todos y todas podemos aprender en esta deconstrucción necesaria, que está reflejada en este lindo slide que fue de Climate Visual Stories, que fue el resumen de la audiencia por la salud de los pueblos.
Thank you so much, Erika, for this beautiful, somber, and rooting all of us into the reality, but also at the same time emphasizing the need for global solidarity and need for women to lead from the front and tackle this crisis that we are facing. And today's interaction was very rich for me. It was very the insights were precious, and it also gives there are a lot of lessons here that we need to collectively think together and take it forward, because we have a momentum. We have a long way to go, but we have started and we are beginning to sort of consolidate our collective power and collective resolve to fight this and to bring equity and justice at the forefront and for the whole world, and prioritize the inequities that have happened. Undo the inequities that have happened, especially from for people from the global south and people from the indigenous community. I'm really sorry we are over time. I had a follow-up question for all of you, but I think we will have to continue our interaction and ensure that this is not just once in a year kind of a sharing that we do. We hope that we stay in touch and we work collectively in building this momentum and be there in a larger force and larger strength, not just in the next COP, but every regional meeting that matters, where our voices can be heard, and the policy to collectively. Sorry, my internet is really bad. Get through all of you. But I might have my colleagues. I'm really sorry about that. Technology is failing me today, unfortunately. But I would like to thank all of you for taking the time off and participating in this really rich discussion. And there are question and answers, the questions in the Q&A box, and I know that a lot of you have responded. And I hope to continue this conversation in the coming months and year. I know we are over time, so I would like to wrap this session and thank all of you for spending your time and efforts in putting this together. Thank you so much. I wish all of you really well. And we are closing of the year, so season's greetings and a very much more positive new year. And we hope to just collaborate and strengthen going forward our movements. Thank you so much, all of you.
Thank you, Shweta, and everyone, and take care.
Thanks, everyone. Bye.
Thanks, everyone.
Bye.